this is questions for Dr. Anggraini from Belen Patrick. Is severity related to NS1 antigen or viremia levels? Please, Dr. Anggraini.
Thank you, Prof. It could be two of them. The NS1 can be made the dengue could be severe, and also the viremia, because both of them share together. If the patient have a high viremia, it means the antigen also high, and it happened also in COVID-19. If the antigen show the high level, it means the clinical patient will be worse than the lower level. Thank you, Prof.
Okay, there's another question. Not sure addressed to which speaker, but perhaps it's for the clinicians in this session. In settings where blood lactate level could not be measured, what is the role of urine lactate level from urine analysis? So
yes.
would Dr.
Yes,
Dr.
Prof. Adi,
like
yes,
to respond to this question?
Yes. If you can check the urine lactate level, it's more it's better because we reduce the invasive practice in our patient that tends to be bleed. But here in Indonesia, we use the peripheral lactate from blood. Thank you, Prof. Adi.
Dr. Ida, any additional response to that question?
No, I think Dr. Anggraini already answered the questions.
Okay, there's one question on my screen. Dr. Ida is still typing an answer, but perhaps this can be responded verbally. I've seen some dengue patients with CKD less likely go to leakage. Is there any correlation to that question, Dr. Ida?
Okay, thank you for the questions. Yeah, the CKD less likely to have plasma leakage. Is that the questions? Yeah, Prof. Adi? Yeah.
Yeah, with CKD less likely go to leakage. Yeah.
Yeah. Okay. Actually, we know that the severity of dengue could be due to severe plasma leakage or due to severe organ impairment. So the most common severe form of dengue is because of plasma leakage. But we also know that some or a few of them will become severe not due to the leakage, but due to the organ involvement. So it might be happen that those who are come to the CKD maybe without any evidence of plasma leakage. Yeah, so because there are another pathway to become severe, not from the severe of plasma leakage, but because involving of severe organs.
Prof. Adi, may I add Dr. Ida about the CKD that infected by dengue. There's one study from Taiwan that showed around 50 patients with CKD, adult patients, and all of them have renal replacement, hemodialysis, or peritoneal dialysis. It showed that the outcome tend to be worse for the CKD patient with dengue. 6 of them get the organ involvement. The study said like that. And 40% have warning sign, and 40% have a severe one. Thank you, Prof.
Thank you. We still have questions for Dr. Tedjo. May I also remind the participants to please use the Q&A and not the chat function to ask questions. Dr. Tedjo, you have two questions. One is in Ambon with THF more than TF, dengue fever cases, is serotype 1 the cause? And then another question about is the lowest serotype is serotype 4. Is this already predicted? Because Indonesia do not have full island serotyping. So is it only protected from certain serotype only? Dr. Tedjo, please.
Okay, thank you, Prof. Adi. So I'd like to answer the first question about the dengue in Ambon. So yes, it's true that more THF patient in Ambon, and it is true as well that there are predominant serotype there is the dengue 1. So this is quite interesting, and we found that it is interesting because actually from the literature we very rarely finding the dengue 1 as a serotype that causes THF. But this we have to consider as well other factors. It could be because of the genetic background in Ambon is different, and then it's also because of the virus genotypes, and also the culture there. Yeah, the culture in Ambon could be that the patient there tends to go to the hospital when they are really in a bad condition. So there are many things that need to be clarified actually for the cases of dengue 1 with a severe manifestation. And then the second question about the dengue 4, yes, it is correct that dengue 4 is the least serotype found in Indonesia. So, but I don't know, I'm not sure what this, the next question is it okay only protected from certain serotype only? I don't really get this. But I think this is from which point of view, yeah? I don't really get it. Only protected from certain serotype. Is that because of the, it is about the immunity against serotypes, or? Yeah, I think, well, I will say that, yes, dengue 4 is the least serotypes in Indonesia, and in consequence, maybe we are not immune against dengue 4 because it's really rare in Indonesia. But still, there are dengue 4, and it's quite mild manifestation, and usually it's in a circulation silently. So our data is also showing that dengue 4 is also there based on the PRNT on people in Jakarta and Java. So it is there. So we still quite not really knows about the dengue 4 in Indonesia actually. I think this. I hope this one can answer the question.
Yeah, okay. If I may just 1 minute for one more question about dextran for resuscitating dengue shock syndrome. Is it better than compared to 5% albumin? Maybe the Dr. Ida or Dr. Anggraini would like to respond very briefly, please.
Yes. Dextran is considered to be colloids. Yeah, so we can use dextrans, but of course, again, when we use colloid, we have to know exactly or well understood how is characteristic of this colloid, the effect on intravascular to replace the loss, the volume loss during the critical phase, and also the side effect when we use this colloid. For example, like dextran, there are many studies showing that one of the side effect of dextrans is because its influence or it can make a coagulopathy. So we have to make sure that there is no contraindication if you would like to use dextran. Albumin 5%, yeah, it is not routinely used for management of dengue shock syndrome because again, besides, it is not in place at the time when the patient is suffered from shock. We need the time to prepare albumin, and it is costly also. And whenever there are another solution that can be used without any specific issue, then it's better to use other rather than albumin 5%. I think that is so far that I know. Thank you.